I'm speaking today, but I'm speaking on behalf of a really big study team from a number of different universities. And the whole project was led by Martin White at Cambridge. So just to acknowledge all my colleagues' contributions before I start presenting them. The work that I'm presenting today was funded by the National Institute of Health Research. All of the people involved in the project have received funding from public and charitable sectors, but we don't have any commercial conflicts of interest to declare. Okay, so just to remind you a little bit about the soft drinks industry, it's actually a policy that was designed and belongs to Treasury, not to the Department of Health. And my understanding is actually that DH didn't really know very much about it until very near the time that it was announced. It was announced by George Osborne when he was Chancellor in his 2016 budget. And it explicitly aims to encourage reformulation of soft drinks, so encourage manufacturers to take sugar out, either replace that with sweeteners or replace it with nothing, or just to take away very sugary products and replace them in their portfolio with less sugary things. So it has a number of characteristics that encourage that reformulation. So firstly, it's tiered. The more sugar that's in a drink, the more has to be paid. And there's these 3 tiers, so less than 5 grams of sugar per 100 mils, nothing to pay, 5 to 8 grams, there's an intermediate amount, and more than 8 grams, the highest amount. It's levied on manufacturers, not on customers. So it's not something that is added to a retailer declared shelf price. It's actually something that manufacturers have to pay in their annual tax return. So they say how much of each type of drink they've sold, and their tax liability increases related to that. And it was announced 2 years before it was implemented, and this was explicitly to give time for manufacturers to change the nature of the drinks that they were selling. So we did a big evaluation. This summarizes the things that we looked at. I'm only going to be talking about the stuff in red here, and actually I'm going to talk about dental health and not BMI. If you have questions on any of the rest of it, I'm very happy to answer those afterwards. Okay, so I'm going to rattle through this quite quickly. I'm going to start by talking about the impact on products, and this is work that was led by Pete Scarborough at Oxford, and used a database called FoodDB that his team have developed, which scrapes information from UK supermarket websites every week. So it gives a weekly snapshot of what products are available for sale, how much they cost, and when nutritional information is provided, it also collects that. So we could use that to see whether there is changes in the amount of sugar in drinks on the shelves. So I'm going to present quite a few graphs like this, and I'll go through this one in quite a lot of detail just to help you get your head around them. So on the x-axis here, we have time. We go from some time before announcement of the levy to some time after implementation. We have these vertical lines that indicate when the levy was announced and when it was implemented. And then on the y-axis here, we have the thing that we're interested in on this slide. And on this slide, it's proportion of drinks with more than 5 grams of sugar per 100 mils. So that's over the lower levy threshold and have to pay something. And so the analysis here is called an interrupted time series analysis. And what we do is we look at the trend in the thing we're interested in before the levy was announced, so before anybody knew about it. And we project that trend forward into the future, and we say, this is what we think would have happened had there been no levy announcement. And then we compare, so we call that our counterfactual, and we compare that to what we actually observed did happen when the levy was announced and implemented, which is the colored line here. And then the statistical analysis is we compare the counterfactual with the observed. So here we have 2 sets of drinks. The red is drinks eligible for the levy, and the blue is drinks exempt. So this is primarily milk-based drinks and pure fruit juices. And you can see just by eyeballing this that the proportion of drinks that were over the lower levy threshold decreased quite a lot in the interim 2 years, and then really started to plummet just before. Hello. Oh, okay. This just started to plummet just before implementation. And so, in fact, we see here a 31 percentage point decrease in the proportion of drinks over the lower levy threshold. And we can compare that to control drinks, which weren't eligible for the levy. And in fact, we find no difference. There was just a flatlining in the proportion of them that were over 5 grams of sugar per 100 mils. So our conclusion from this is that we do see a change in products. There does seem to be some reformulation. But we don't know, this is just one drink counts for one observation point. We don't know if this translates into changes in what people are buying and consuming. So to look at that, we used data from Kantar World Panel, which is a household purchasing panel. About 30,000 households across Great Britain record all the groceries they bring into their home. And an analysis led by Nina Rogers here, we looked at whether sugar purchased from soft drinks changed. So, and the question we're really asking is, was it the drinks that people buy that changed, or was it all the peripheral ones that hardly anyone buys that we see in that previous analysis? So you can see here that there was actually a big kind of trend towards decreasing sugar purchase from soft drinks even before the levy was announced. So there was changes afoot, and this is probably related both to changes in people's habits, and in some of the supermarkets had already announced that they were going to take sugar out of their drinks. When we look at right at the end here, there was an additional effect that seems to be associated with the levy of about a 3% decrease in the amount of sugar purchased by households. This is per household per week. Okay, but that's, so purchasing is at the household level, so we don't really know how this impacts on consumption, and there might be waste at the household level and people buy soft drinks that they don't bring home. So we also wanted to look at actual consumption of sugar. That's the thing that impacts on your health. So to do that, we looked at, we used the National Diet Nutrition Survey, which collects data from 1,000 people across the UK each year, so 500 adults and 500 kids. And at the time, it asked them to record absolutely everything that they ate and drink over 4 days. So we can use that to look at free sugar consumption. And I've separated this out into adults and children here. And again, you can see that there was a kind of a decreasing trend in free sugar consumption over time in both adults, more prominently in children, even before the levy was announced here. But we see, again, an additional decrease in consumption in both groups, larger in adults than in children. And in adults, about 2/3 of, so these graphs are for all sugar across a total diet. In adults, about 2/3 of this was attributable to drinks. And in children, about half of this additional decrease was attributable to drinks. And so I think that what this tells us is that it's not just that drinks are being reformulated, but that there is a wider piece of messaging that's happening in the population that seems to be associated with the levy, that's saying sugar, like government is taxing sugar, that encourages us to avoid it, and people are avoiding it more across their whole diet and not just in the drinks that have been reformulated by manufacturers. Okay, this is all kind of a story that's going in one direction, but then the next question is often said, but no one has ever demonstrated the impact of a soda tax on health. That is not quite true, but so we did want to look at impacts on health. We thought that probably the very first thing that would change was dental health, because dental health responds very quickly to changes in sugar consumption, and kids' dental health particularly responds. So children's teeth are very vulnerable to sugar consumption. There is no regular community dental health survey in the UK. I think there is one that happens every 2 years, but we didn't think that that was rapid enough data to collect the changes that we thought we might see. So we use something called hospital episode statistics data. So this is just a record of everybody admitted to an NHS hospital. And it's coded based on their diagnosis. In this case, we looked for children and those who were admitted for severe dental caries, so for severe dental decay. And that has to be really advanced to get you admitted to hospital. You can imagine that your kid is admitted to hospital because they need a tooth extracted. Maybe they're having a number extracted, or the other reason might be that they just really don't like being in the dentist chair, and so they need an anesthetic and they're admitted to hospital for that reason. So we see a similar graph as before. We see actually a fairly flat line in admissions for severe dental caries. This is in England before the levy's announced, but that seems to deflect at the point that it is announced. And so by the end of our analysis here, we see a 12% reduction in admissions for severe dental caries associated with the levy. We actually disaggregated this by age, and this effect is greatest in the littlest kids, so preschool and early primary school kids. We also looked for socioeconomic inequalities, like dental health is much worse in less affluent, children growing up in less affluent circumstances, but we didn't see any clear socioeconomic trend in effect of the levy, so all children and all groups were benefiting. And the last thing that I'm going to talk to you about is modelling work that's looked at wider impacts on population health. This is work led by Linda Kobiak, who was at Oxford at the time, and it's the bit that I understand the methods of least, so would be grateful for not too difficult questions on this. But what Linda finds is she takes the change in sugar purchase from soft drinks, so that was the smallest, our most conservative estimate of impact, and she projects that forward using the prime time model, which crunches changes in diet into changes in health outcomes, and finds a significant reduction in cases of overweight and obesity. Those then lead to significant reductions in various different chronic diseases associated with higher weight. And overall, she finds if we follow the population in 2015 to their death, that we see a benefit of 200,000 quality adjusted life years gained, substantial reduction in healthcare costs, and those two things together lead to a saving to Treasury, either of productivity gained or healthcare costs averted, of something in the region of 12 billion. Okay, I've gone through this really quickly. To summarize, what we find is there's evidence that the levy was associated with reformulation of products, reduction in sugar purchased from soft drinks, that tracked through to reduction in sugar, free sugars consumed across the whole diet. We see benefits to dental health that we were able to measure, and then we were able to model the change in sugar purchase from soft drinks through to longer term health benefits. I will also very quickly tell you that there was a very small decrease in company profits and soft drinks company profits immediately the levy was announced, but that quickly recovered. There was, when we looked in how industry was responding in the news media, they kicked up quite a big fuss initially, like threatened legal action, etc. Really quickly, they got over it and started to say, this is fine, this is the sort of stuff we do as responsible companies anyhow. Politicians thought it was great. There was a lot of discussion about it in Parliament. They judged it to be successful before any evaluation had been published. So they were very pleased with it. And we also find that public acceptability was high and remained high throughout the period that we looked at. Okay, I'll leave it there. If you have any questions, we're glad to take them.